Hello everyone, it is Zach coming at you from California, where I've been born and raised. I had top surgery 8 days ago in Green Bay, California, about an hour and 45 minutes north of where I am located. My surgery was a bilateral mastectomy done by Dr. Thomas Satterwhite under Brownstein and Crane Surgical Services. Dr. Thomas Satterwhite is not as well known as Brownstein or Crane. Brownstein retired and Crane took over, but he does do quality work and it is up to par. He's very great at the symmetry and contouring it to your own body. I had my pre-op appointment the day before surgery. We went out Tuesday the 5th, Cinco de Mayo, and we saw a Giants game. And then the next morning was my pre-op appointment. So we just went over all the paperwork again because we've already sent the money last month. Everything was already cut and dry. Assured me that I would look great and took a peek at what he would be working with the next morning. The following day was my surgery. I went in about an hour before my appointment, and they recommend you be early to that appointment. I signed a few more pages of paperwork, and then they called me in to get dressed in my gown. I was given a locker and a bag to put all my stuff in. I put my cell phone and all my belongings in there. The only article of clothing that I actually owned that was on my body after I was changed into the gown was my underwear. I took out my piercings and my tongue, and I took out these just so they wouldn't fall out or anything. I went into what was the recovery room, and they set me up with the IV. Dr. Satterwhite came in, did the markings on my chest. They put a bag of liquid Tylenol, I believe, through the IV, and that calmed me. The anesthesiologist came in and talked to me. One of the nurses walked me to this operating room, and it was very bright, it was very white. They use a nickel as a guide. That's what my nipples were resized to, about the size of a nickel. When it came to anesthesia, they didn't give it to me until I was walked into the operating room, and I laid down on the table on top of the surgical vest and gauze that would be put on me right after, and I laid down. They had the cushion under my knees. They had these things that were like the blood pressure things that go around your arm, only they put it on your legs, and it's to promote circulation during surgery, which reduces complications, and that's really relaxing. So the anesthesiologist was like, okay, I'm gonna give you the good stuff now. And then I fell asleep. Once I have fallen asleep, the anesthesiologist puts the mask on, and they take it off before you wake up for the duration of the surgery. There was no complications with my surgery. I woke up in the recovery room. My surgery was 2.5 hours, give or take, and then it usually takes about 30 minutes to an hour to recover from the anesthesia, and I didn't actually have any problems whatsoever with anesthesia or anything. Went back to the hotel room, slept in that room that night. I was mobile, but I had to get help to be sat up, and when I used the restroom, I needed help pulling my pants back up, and I really didn't have much mobility or anything. But once the surgical vest was taken off 6 days post-op on my post-op visit, much of the discomfort was alleviated, and I had much more mobility. I took pain meds up until the 5th day, and then I needed it the day they uncovered it, but I didn't take anything. And then I took some yesterday. Yeah, I took some yesterday and some today because there's slight pins and needle type feelings that I'm getting. So yeah, that was my experience with top surgery. So take care and have a wonderful day, everyone. Bye.